Hello everyone, we now continue our discussion of the parotid gland, and as we have previously said, it is pyramidal. It has an apex, it has a base, it has an anterior border, it has a posterior border, it has an external surface, and on its inner side it has an anteromedial and a posteromedial surface. So you have an anteromedial surface here and a posteromedial surface here, and the anteromedial surface is indented by the ramus of the mandible with the attachment of the masseter outside and the medial pterygoid inside. The posteromedial surface is indented by the mastoid process with the sternocleidomastoid outside, the posterior belly of the digastric to the inside, and also by the styloid process and its attachments. And between the anteromedial and the posteromedial surfaces, it again has a small medial border. This medial border goes deep to the styloid process and comes very close to the wall of the pharynx. So this is also called the pharyngeal border of the parotid. Now if we take a look at these surfaces separately, if you look at this external surface, if you come to the surface from the skin, below the skin and subcutaneous tissue, you have the cutaneous nerves, that is the great auricular nerve supplying the patch of skin over the parotid. And then if you reach the investing layer of the deep cervical fascia, the investing layer of the deep cervical fascia splits to enclose the parotid gland, of which its superficial layer goes right up to the zygomatic arch as the parotidomasseteric fascia. This is a very stiff fascia covering both the parotid gland and the masseter, and the deeper layer goes underneath the parotid gland to the tympanic plate over here and the deeper styloid process. And from the styloid process to the angle of the mandible, you have a condensation of this deep cervical fascia, the deeper layer, which is called the stylomandibular ligament. And this stylomandibular ligament separates the parotid gland outside from the submandibular gland inside. So this is so much about its external surface. And also just deep to this parotidomasseteric fascia, you have some superficial parotid lymph nodes, whereas the deeper parotid lymph nodes are embedded within the gland's substance itself. Now if you take a look at the apex, as you can see from here, the apex extends beyond the face and it goes partly into the digastric triangle over here and also into the upper part of the carotid triangle. So the apex protrudes right up to the carotid triangle. The base is molded by the tympanic plate, and the base is shaped also by the tympanic plate. And from the apex here you have certain structures emerging, from the base you have certain structures emerging. Now this here is the anterior border of the parotid gland, and from the anterior border you can make out the parotid duct, and on the parotid duct lies a detached part of the parotid gland which is called the accessory parotid gland. It may be present, it may not be present. So you have the anterior border of the parotid gland passing superficial to the mandible and overlapping this masseter muscle, and likewise you have a posterior border going right up to the mastoid process. So anterior border, posterior border, apex and base. Now let us see what structures are actually protruding out of these borders. Now from this anterior border you can make out the following structures: the branches of the facial nerve, that is the zygomatic nerve, the upper buccal, the lower buccal, and the marginal mandibular branches. Apart from that, you can make out the transverse facial artery and the parotid duct itself, and also the small accessory parotid gland. From the apex you can see you have the emergence of the cervical branch of the facial nerve and the two divisions of the retromandibular vein, of which the anterior division unites with the facial vein to form the common facial vein draining into the internal jugular vein, and the posterior division uniting with the posterior auricular vein to form the external jugular vein draining into the subclavian vein. From the base of the parotid gland, you have the emergence of the superficial temporal vessel, the auriculotemporal nerve, and the temporal branch of the facial nerve. And likewise, from the posterior border, you have the emergence of the posterior auricular artery as well as the posterior auricular branch of the facial nerve. Now, this posterior auricular artery is a branch of the external carotid artery. Superficial temporal artery is a terminal branch of the external carotid artery, the other terminal branch being the maxillary artery, which you cannot see from here. So, external surface, anterior border, posterior border, apex and base. Now we will look at the inner surfaces. If you look at the inner surface, that is, on the inner side you have two surfaces. You have an anteromedial surface and you have a posteromedial surface. Let us look at the anteromedial surface. So you can see this anteromedial surface being indented by the ramus of the mandible. So here outside the ramus of the mandible you have a projection, a prolongation of the parotid gland, which is described as the facial process. Likewise, medial to the ramus you can have another prolongation of the parotid substance, which you would call the pterygoid process. So you have a facial process here and you have a pterygoid process here. And if you look at the posteromedial surface, again here it is indented by the mastoid process. That means the sternocleidomastoid here on this impression and the posterior belly of the digastric here on this impression. And further on its deeper side you can see the indentation by the styloid process and its attachments. So if the styloid process indents the parotid gland on the posteromedial surface, here you can make out a pre-styloid process and a post-styloid process. So these are all prolongations of the soft parotid substance in front of the styloid, behind the styloid, in indentation by the sternocleidomastoid muscle, indentation by the posterior belly of the digastric, and through this posteromedial surface you can see the entry of the external carotid artery. So you see the external carotid artery is giving its posterior auricular branch here and entering the parotid gland to form superficial temporal and maxillary arteries. And you can see the retromandibular vein, its posterior division emerging out through the apex. Now the superficial temporal artery will go up like this, but the maxillary artery will come out through this anteromedial surface. So maxillary artery will come out through the anteromedial surface behind the neck of the mandible, and transverse facial artery will come out as a branch of the superficial temporal through the anterior border. So here it is further clarified, the anteromedial surface with the ramus of the mandible, masseter, medial pterygoid, posteromedial surface with indentation of mastoid process, sternocleidomastoid, posterior belly of digastric, styloid, pre-styloid, post-styloid process, pterygoid process and the facial process. And not only that, if you look at the entire parotid gland, just between the temporomandibular joint and the tympanic plate there is a further gap in which a small part of the parotid gland does insinuate itself somewhere here between the temporomandibular joint over here and the tympanic plate over here. You can see a further prolongation of the parotid gland. This is called the glenoid process. So now we have discussed all the surfaces, borders, apex and base of the parotid gland. In the next video we will look at some other features. Thank you.